So you're turning 65 and all of the mail is starting to flood in on Medicare. You want to know, what are your options? I'm 𝗪𝘁𝘁𝗀𝘀𝘀, president of Magellan Healthcare. We're here to help you figure out what you need to do and how you can get the coverage you need. Let's start by talking about Original Medicare. Original Medicare is segregated into two sections, Part A and Part B. Part A of Original Medicare is for your in-hospitalization stays. This is going to cover things like being in the hospital for surgeries, having to go to a rehabilitation hospital for a short period of time, in-hospice stays, and in some cases, in-home healthcare stays. Part A is available to you traditionally at no cost because while you were working, you paid into the Medicare tax. If you've paid for 40 quarters or 10 years, Part A is available at no additional cost to you. Now, if you haven't done that, don't worry. Oftentimes, you're going to qualify under your spouse having paid into those taxes, or the worst case scenarios, we're going to look and see how much you will need to pay for your Part A coverage. In addition to Part A, you enroll in Part B. Part B Original Medicare is your day-to-day health coverage use. This is what you use for your preventative services, such as doctor's visits, lab results, x-rays, and sometimes for things like mental health visits, wellness visits, or even visits with acupuncture specialists and other needs. Also under Part B, there is durable medical equipment, such as your diabetic pump, and sometimes you can get drugs administered by your doctor at Part B for lower than what it would cost to do through a standalone drug program through your pharmacy. Part B has a monthly premium associated to it. That premium is going to be decided by how much you made during your working years. As you decide to join Medicare, they're going to do a 2-year look back to see what you made in your last 2 years and filed with your taxes. That modified adjusted gross income is what they look at and 2 years prior to joining Medicare. If you made more than the standard threshold for Medicare Part B, they're going to add what's known as an income-related monthly adjustment amount. So basically, if you made more, you're going to pay more. In 2022, the standard Medicare premium for Part B is $170.10. That amount will ratchet up over to $500 a month. If you're married, you and your spouse will each have your own Part B premium that you're required to pay once you're both enrolled in Original Medicare A and B. All right, I know that sounds clear as mud, so let's really look at what Original Medicare is going to do. Once you join, it's going to help cover many of your needs, but you will have co-insurances that you're responsible to pay for Part A. And on Part B, you'll have a deductible that you meet annually, and then the government will cover 80% of your Medicare eligible required services, and you will be responsible for 20% of those fees. There's no cap to these amounts, so that's where the gaps in our Medicare coverage come in and why there are other programs that you need to consider. Medicare supplements or Medicare Advantage plans are those two programs that you can look at and decide what's right for you. There are no bad options. There's just the option that fits your lifestyle, your income, and your health preference. Give us a call and we want to help you to figure out which will fit your needs best and tailor a program so that you feel comfortable when life happens.